Right now, I want to take you to Kumasi because there's a news conference being held by the Regional Health Directorate. Dr. Emmanuel Tinkorang is leading that news conference, and he is speaking to issues as far as health workers are concerned. He's addressing concerns that some health workers may have been infected in the line of duty whilst treating COVID-19 patients. Let's go live.
It's truly COVID. That's the reason why national usually takes a lot of time, because once they put it on the platform, national platform, it ends there. Ours is more like a provisional. So that is what we need to understand, so that it doesn't create confusion between Ashanti Region and the national. I'm saying this because we've had a number of calls. People wanted us to explain why our desk is quite different from that of national. And that's the reason why we are having these differences. So that's that. Then the next issue is that almost all the treatment centers are now full. Kofanoche have 18 beds. The 18 beds are now full. Kumasi South have 20 beds. So as at now, we have a total of 38 beds. All the 38 beds are now full. So what we've decided to do is that we need to expand the number of the beds that we have for the treatment centers. So we've decided that we are going to expand Kumasi South from existing 20 beds to 41 beds. As at now, we've been given another ward. Work is rapidly ongoing to make sure that we expand it. We've also secured 7 beds at Central Hospital to support our treatment facilities. And we are also negotiating with one of our senior doctors who has decided to give us his hospital to be used as a treatment center. When that one is finally done, we hope that we can add about 100 beds to the treatment centers that we have to make sure that it will be up to about 38 beds. Because the numbers that we have here and the number of cases that we are getting, it said that we cannot contain it. The challenge we have here is the way cases are referred to our major treatment center, Kofanoche. Most of the cases are being kept in various hospitals, and when the situation gets worse, then they say go to Kofanoche. And by the time you get to Kofanoche, less than 24 hours, then you are gone. I don't think that is good enough. We need to build the capacity of our peripheral facilities also to support the process. We'll have to build the capacity of the nurses there to identify the cases. The challenge we have with COVID deaths that we've analyzed here is that most of the deaths do not come with the classical signs and symptoms that we know. The cough, difficulty in breathing, and other things sometimes are absent. All that we get is a malaria-like symptoms. So people assume that it's malaria. By the time we get to know that it's COVID, then a lot of health workers have been exposed. And because of that, most of them are now doing self-isolation. So there's a need also at the national level to review the signs and symptoms and then share it with the private facilities so that we do not focus only on certain signs and symptoms like cough, difficulty in breathing, and then it's COVID. Because in Ashanti Region, we are seeing quite different picture. It's fever and general malaise. By the time you have difficulty in breathing, then you're almost gone. So it's another work that I think we will need to do here. The number of isolation centers will also have to be increased because we are having increasing number of cases. As at now, we have a total of 207 bed isolation centers. Yesterday, we were fortunate we discharged most of them. Other than that, we're also going to have the same challenge like that we have for the isolation the treatment centers. So that means that we have to get more isolation centers. Already we have spoken to Ghana Registered Nurses Association, so they've given us their hostels to be used as an isolation center. So in addition to the TUC, the Edriso one, we are also going to have another isolation center, and I believe that will also help. But the bottom line with Ashanti Region is that we need to adhere by the protocols and then the guidelines as has been prescribed by the president. Going around the region, and especially working in Kumasi, sometimes you feel so disheartened because people don't want to adhere to the protocols and then the guidelines. Now, we don't see the Veronica buckets anywhere. The social distancing protocol, nobody is observing it. You tell people to wear face masks and they are insulting you. With this, we can't fight COVID-19. People get conditioned, we want to support them, they fight with us. How can we fight COVID-19 in this situation? The buck starts with you. The president has instructed that we enforce it. This morning, I went around looking whether people will adhere to what the president said. Some of them, they've disregarded what the president said. They are still walking around without their face mask. They are not observing the social distancing. So what do you want us to do? Ask people. That is not the way to go. Because right now, you know, we've lost a doctor, a hard-working doctor. And if it's to continue this way, what will happen? We are going to lose more. So my only appeal to people in Ashanti Region is that let us obey instructions. Let us adhere by the laid down protocols and then the guidelines. Because with the ease of restrictions, it's likely that we may have cases going up. The facilities that we have in Ashanti Region, as far as case management is concerned, is nothing to write home about. Accra may have UGMC, they may have Kolebu, they may have 37 military hospital, they may have police hospital. Ashanti, apart from Konfanochi Teaching Hospital, we don't have any facility that we can say can manage severe and critically ill. And that means that if we continue in this direction, we will see high mortalities. So what we need to do as a region is to make sure that we adhere by the public health principles. Other than that, we will have a lot of challenges. So the media, what you can do to help us is that let us try and then talk to people who don't want to obey any law in this country. I believe that it's time that we deal with them. We need to enforce the wearing of the face mask. And I believe we have the support of our regional minister. Even he started. And then some civil rights organizations and other things came in and said it's against the law. Nothing is against the law more than your life. We will not continue to live in this situation in Ashanti. And yesterday, talking to the regional minister, whether you like it or not, we will have to enforce it.
So that's the Ashanti Regional Health Director, Dr. Emmanuel Tinkorang, ending on that note on enforcement in the wearing of face masks. Here in Accra, our checks show that many people are not wearing face masks in town. We'll be checking across the regions to see how they are actually enforcing this directive announced by the president. Let's take you from the Ashanti region. Let's go to the Volta region now and speak to the regional minister, Dr. Archibald Letcher, issuing a stern warning on the enforcement. Doc, thank you very much for your time here on News Desk. The president did announce that the face mask is mandatory and that it should be enforced. I'm wondering how you're doing that in the Volta region, seeing that we do not have the executive instrument to back that. Well, we seem not to have Dr. Archibald Letcher on the line. We're working the lines to get him to find out how the region is implementing the directive for the wearing of face masks. Once we have him, we'll bring that to you. Right now, we're taking a break. When we return, we'll bring you that interview and more here on News Desk. Stay with us.